Scoliosis in pregnancy. Get your questions answered. Scoliosis is an unnatural sideways spinal curvature that also rotates. Scoliosis is also a progressive condition, has it in its nature to worsen over time. When I diagnose women with scoliosis, I'm often met with questions about scoliosis in pregnancy, so let's go ahead and address the most common one. Does scoliosis make it hard to get pregnant? Scoliosis can affect the body in many ways, but a patient's fertility is not considered to be a conditioned effect. The main effect of scoliosis in children is postural deviation, and in adults, it's most likely to cause pain. Does scoliosis make pregnancy more painful or vice versa? Scoliosis can cause back pain and pain that radiates into the extremities due to nerve compression. This is the main symptom in adults by far. Scoliosis can also compromise the spine and surrounding muscles and nerves, and this is the main symptoms that patients feel as a result of scoliosis. Back pain can be a common part of any pregnancy, and if a patient's in good physical shape and health going into the pregnancy, their scoliosis is unlikely to make it more painful than normally it would have been to be, or vice versa. Remember, pregnancy does engage the pelvis, not the spine, and therefore we think it's not going to have a significant effect on developing back pain or increase the rate of having back pain. So if a patient is staying fit and active and is taking care of themselves and is an ongoing proactive conservative treatment that can improve their scoliosis, their condition is unlikely to cause an increase in pregnancy pain or vice versa. Does scoliosis complicate delivery? Other than needing to be aware of a scoliosis curve and location and severity when administering an epidural, scoliosis doesn't really interfere with delivery. Scoliosis isn't associated with increased rates of cesarean section, nor is it known to prolong labor and delivery. However, the epidural can be a significant problem. So if you have scoliosis and you know that you're going to go into the hospital and you're considering an epidural, I recommend you bringing in a copy of your x-ray or a printout of your x-ray so that your anesthesiologist can know where your spine is and which way it rotates to, so therefore they can try to deliver the most accurate epidural as possible. Another question I get asked is, can I pass scoliosis on to my baby? Well, scoliosis is not considered to be genetic, so it can't be really passed on. It's not a disease or that's contagious that somebody can catch. Scoliosis does have a familiar tendency. That means it's more likely that when somebody in the family has it, it's more likely another person in the family can have it. However, it's not considered to be genetic because they've done testing on identical twins. These are patients with the exact same DNA, and they've only found 60% of patients with the identical twins both have scoliosis, 40% don't, and even the ones they do can have completely different size curves. So there's other factors that we don't know what could be leading to development of scoliosis. So we know there's a familiar connection, but it doesn't necessarily mean if you have scoliosis, your child's 100% going to have scoliosis or not. If you don't have scoliosis, it doesn't mean your child is not going to have scoliosis. There's other factors and variables that we don't know. Does pregnancy impact treatment or vice versa? Now, pregnancy can have some limitations on treatment, but it doesn't totally stop treatment. Meaning if patients are experiencing symptoms or problems as a result of their scoliosis, they can engage treatment during pregnancy. The treatment will have to be adjusted to match the patient's shape and shape of their torso and to deal with the complications or risks associated with pregnancies. There's actually theories associated that when a patient is pregnant, that they're producing hormones that help relax the ligaments, and helping relax the ligaments for childbirth can sometimes make the spine more responsive to treatment, meaning they're easier to actually straighten. And there are opposite theories that say the spine can also be vulnerable towards progression during a pregnancy. But we really don't know because it's very difficult to research this because no two curves progress the same. And it's very hard to know that what actually happens as a result of pregnancy. However, what I find is that if a patient wants to do treatment, pregnancy doesn't have to be 100% a contraindication to treatment. It just means that we have to take into account their pregnancy during their treatment, so therefore they can have a successful treatment and a successful pregnancy. So we know scoliosis affects the spine, but it doesn't really affect the pelvis as severely as it affects the spine. And since pregnancy engages the pelvis mostly, scoliosis has a minimal effect on women's ability to have pregnancy, or they feel in pregnancy, or any problems that could be occurring during pregnancy. So therefore, we consider not to be a significant factor. So if a patient has scoliosis, they shouldn't fear becoming pregnant or becoming worried about becoming pregnant. However, if they want to treat their scoliosis and they're pregnant, they shouldn't have any fear of going through scoliosis treatment if they are. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.